I had dentures for like 3 years and I just didn't like them. They were just very uncomfortable. You take them out every night, you put them in every day, you use an adhesive. It never worked.
My upper teeth were in pretty bad shape. My dentist basically informed me that this was a procedure I needed to get done. St. Luke's is who my dentist recommended. They felt comfortable with them, so I trusted in them as well.
I looked up St. Luke's because that's where I would always go for anything I ever needed, and that's how I ended up here.
We call it OMS because it rolls off the tongue a little bit easier, but our official title is Oral and Maxillofacial Surgery, reflecting that not only do we care for the mouth, but all of the facial structures as well. So depending on where you meet me, if you meet me here in the office, I may be the doctor that takes out your wisdom teeth. If you meet me in the hospital, I may be the doctor that's reconstructing you after you've suffered a traumatic injury. A dental implant is really the ideal way to replace a missing tooth, and they're quite versatile because you can replace a single missing tooth, you can replace multiple missing teeth, or in some patients, we can replace all of their teeth.
The preparation process was relatively simple. The staff here really puts you quite at ease.
I think a lot of patients come in, they have these preconceived notions of what's involved in dental implant. I think a lot of patients are scared by it. During the initial consultation, I'll examine the patient, and then we'll talk about the actual procedure itself. And I usually tell most patients that this is easier than having a filling done. There's absolutely no pain during the procedure. And even after the procedure, most patients surprisingly have very little to no pain.
I had no pain, minimal bleeding, minimal swelling. I would recommend St. Luke's to other patients just because of the ease.
The nice thing about a dental implant is that it's the closest thing to your own natural tooth.
I can eat apples now, and corn on the cob, and nuts, and things that I wasn't able to eat with the dentures.
For the casual observer, if they're looking at you if you had a dental implant, they would have no idea that that was an implant.
I would do the typical, kind of hide your mouth type of thing. I had some issues in the right side, so I learned how to dip my lip to kind of compensate for it. I used to have to hide my smile, so now I'm quite proud of it.
I really think that oral surgery is sort of like the bridge between dentistry and medicine. As a practice, we probably have the most experience in the Lehigh Valley in placing dental implants. We are current on all the latest technologies. We just started placing implants using guided surgery, so there's very few practices in the country that are doing that. So I think we all pride ourselves that we're really on the cutting edge, on the forefront of dental implants.